Welcome back to the Hydrogen Studies podcast, where we break down the science of molecular hydrogen and how it can change your health. Today, we're diving into one of the most widespread, complex, and expensive chronic diseases of our time, diabetes. Type 1, type 2, early stage, advanced stage. At the root of it all is the same cellular stress, oxidative overload, inflammation, and metabolic dysfunction. And now, we've got a growing body of research showing that hydrogen water and hydrogen gas may play a powerful role in reversing some of the damage. Today's episode is grounded in peer-reviewed research. We'll explore why oxidative stress is the real driver of diabetic complications, how hydrogen helps regulate blood sugar in type 1 diabetes, how it improves insulin function in type 2 diabetes, and what human trials are showing in real-world patients. This is the Hydrogen Studies Podcast, sponsored by Echo Water. Let's start with a simple truth. Blood sugar isn't the root of diabetes. It's the visible effect. The real problem begins at the cellular level, where energy, metabolism, inflammation, and free radical production all go off the rails. The 2021 review, Oxidative Stress, Pathogenetic Role in Diabetes Mellitus, lays out the mechanics of this clearly. According to the authors, both type 1 and type 2 diabetes are driven by chronic oxidative stress, and it's that oxidative stress that fuels most of the complications. Think kidney disease, blindness, nerve damage, and even heart failure. We know that oxidative stress means your cells are producing too many reactive oxygen species, or ROS, unstable molecules that damage DNA, proteins, and lipids. In a healthy body, antioxidant systems keep ROS in check, but in diabetes, glucose metabolism becomes erratic. Mitochondria start leaking ROS. The antioxidant defense system gets overwhelmed, and the result is a vicious cycle of inflammation, cell damage, and worsening blood sugar control. The review highlights several core pathways that ROS disrupt in diabetics. Beta cell destruction in the pancreas, which limits insulin production, endothelial dysfunction, which damages blood vessels, impaired glucose transport, which leads to insulin resistance, and chronic low-grade inflammation, which feeds the fire system-wide. And here's the kicker. The longer this stress loop runs, the harder it is to reverse. That's why diabetic complications often show up even when people are doing everything right, because the cellular environment is still hostile. The review makes the case that targeting oxidative stress is essential, not optional. In any therapeutic approach to diabetes, and as we have seen in previous episodes, hydrogen is a promising candidate to do that without side effects or metabolic interference. So when we talk about hydrogen-rich water or hydrogen inhalation, we're not just talking about symptom management. We're talking about a tool that addresses the root cause, one that can intercept the stress loop before it spirals into full-blown damage. We'll look at how this plays out in actual studies, starting with type 1 diabetes and how hydrogen helps muscle cells absorb sugar, even when insulin is low or absent. But first, a word from our sponsor. Your body is a system, and when it's running right, you feel focused, energized, in flow. But sometimes we struggle to find that flow state. Why? Because there's too much static in our system. Brain fog, fatigue, and inflammation. The Echo Flask clears the static by infusing your water with molecular hydrogen, a natural, science-backed gas that helps your body think sharper, recover faster, and run smoother. This is more than hydration. It's better focus, more energy, faster recovery, less internal stress, and long-term benefits that keep you sharp. When your water works harder, your whole system does too. Find your flow state with the Echo Flask hydrogen water bottle and get an unlimited supply of hydrogen water at home and on the go. Visit echowater.com and use code H2Studies to get 10% off of your first order with Echo Hydrogen Water products. Type 1 diabetes is often misunderstood as simply a lack of insulin, but at the core, it's a complete shutdown of the pancreas's ability to produce insulin due to an autoimmune attack on the beta cells. That means the usual mechanism for pulling glucose into cells via insulin-triggered GLUT4 transporters break down. In this state, even if glucose is available in the blood, the cells are essentially starving for fuel. And the result is fatigue, muscle breakdown, and a dangerous buildup of glucose that can lead to long-term damage. And here's where hydrogen shows a fascinating new potential. A 2013 animal study investigated whether molecular hydrogen could help type 1 diabetic mice manage blood glucose levels without relying on insulin, and the results were remarkable. Researchers induced type 1 diabetes in mice using streptozotocin, a standard method that destroys insulin producing beta cells. The mice were split into two groups. One received regular water, the other received hydrogen rich drinking water or hydrogen rich saline injections over several weeks. No insulin was administered to either group. The outcome was blood glucose levels in the hydrogen group were significantly lower than in the untreated group. GLUT4 expression in skeletal muscles was markedly increased, and this transporter is crucial for shuttling glucose into cells and is usually activated by insulin, but here it was stimulated independently by hydrogen. So what does this mean practically? Hydrogen appears to mimic or enhance insulin's downstream effects, especially in skeletal muscle, which is one of the body's largest glucose sinks. Even without insulin, hydrogen helped the body clear blood sugar and convert it into usable energy. The bottom line is, this isn't just symptom relief. It's metabolic rescue at the cellular level. Now let's take a look at type 2 diabetes. Type 2 diabetes is defined by insulin resistance. Unlike in type 1, the pancreas is still producing insulin, but the body isn't responding to it. Over time, blood sugar rises, insulin production burns out, and complications set in. Oxidative stress, again, is the key driver here, damaging insulin receptors, impairing glucose transport, and inflaming tissues throughout the body. But research is now showing that hydrogen can interrupt this cycle both by enhancing insulin activity and by protecting the pancreas from degeneration. Let's look at the first study. In this experiment, researchers induced type 2 diabetes in rats using streptozotocin, a compound that impairs pancreatic function while mimicking insulin resistance. Some rats received hydrogen-rich water daily, and others did not. The results were significant. Hydrogen-rich water significantly increased serum insulin and the expression of insulin receptors supporting better glucose regulation. In addition, treatment with hydrogen-rich water elevated superoxide dismutase, an antioxidant enzyme, levels in both serum and liver. Importantly, hydrogen-rich water showed similar effects to metformin, a traditional diabetes medication, without noted adverse effects. In another study, this time in humans, researchers looked at the biological markers behind the results, using hydrogen-rich water generated through electrolysis. This time, the focus was on what hydrogen was doing at the cellular and molecular level. After 8 weeks of drinking 1,500 milliliters of hydrogen-rich water daily, participants showed significant decreases in urinary 8-hydroxy-2-deoxyguanosine levels and its rate of generation, indicating lower systemic oxidative stress. Fasting blood glucose and fructosamine levels decreased, while 1,5-anhydro-D-glucitol increased markers that collectively suggest better glycemic regulation. At the molecular level, the electrolytic hydrogen water scavenged hydroxyl radicals effectively, and its nanobubble structure allowed high hydrogen retention even after boiling. These results reinforce that hydrogen improves the actual biology of insulin sensitivity, cellular integrity, and oxidative defense. It's one thing to see promising results in rodent studies and lab tests, but the real question is, does hydrogen therapy work in people with diabetes in the real world? That's exactly what a recent observational study set out to answer. This was a retrospective real-world clinical study, meaning researchers looked at actual patients being treated in normal clinical settings, not under tightly controlled lab conditions. Here's how it worked. 1,603 adults with type 2 diabetes were split into two groups. One group received standard diabetes care, medications, diet, lifestyle advice. The other group received the same standard care plus hydrogen gas inhalation, approximately 2 to 4 hours per day, using a certified inhalation device. The study tracked outcomes over several weeks, and the results were hard to ignore. Fasting blood glucose dropped more significantly than in the standard care group. HbA1c levels, which reflect average blood sugar over 3 months, also dropped at a faster rate. Insulin resistance and beta cell function improved, as shown by improvements in HOMA-IR and HOMA-B scores, both standard clinical measures. Adverse events were less frequent with hydrogen, including lower rates of hypoglycemia, vomiting, constipation, and dizziness compared to controls. In particular, the insulin sensitivity shift was striking. It indicated that cells were beginning to respond better to the insulin they already had, allowing for better glucose control without increased medication. And that's especially important in patients who are maxed out on oral medications or starting to depend on insulin therapy. Hydrogen may offer a way to enhance what's already working, reduce drug burden, and potentially show disease progression. Unlike small pivot trials, this was a large population in real-world conditions, people of different ages, with different levels of control, comorbidities, and medication use. And yet, the hydrogen group saw better glycemic control, better insulin function, and zero safety issues. This isn't just science, it's clinical relevance. It means hydrogen therapy isn't stuck in theory or in animal models. It's already being used successfully in medical settings with results that could apply to millions. So, what have we learned? Diabetes is driven by oxidative stress and inflammation, not just sugar. Hydrogen helps break the cycle by neutralizing harmful ROS, improving glucose uptake, and protecting insulin-producing cells. In type 1, it helps muscle tissue use sugar more efficiently. In type 2, it reduces resistance and supports pancreatic function. And in humans, it shows real promise, safe, effective, and accessible. Hydrogen therapy, whether through high-quality hydrogen water or controlled inhalation devices, may soon become a trusted adjunct therapy for diabetes management. As always, make sure you're using legitimate, high-concentration hydrogen products for the best results. Well, that's it for this episode of Hydrogen Studies. Thanks for listening. Stay healthy, stay curious, and we'll catch you next time.